And this is my examination of the lumbar spine. I have Cece with me today who's kindly helping out, thank you very much. And just before we do any examination with any patient, I always like to get a full and detailed history from them, especially about any history, mechanism of injury or history of pain and any previous injuries or operations that they may have had. And I also like to ask quite a bit about the pain. Where does it radiate to? How would they describe it? And that just focuses in our examination, but we don't have time to do that today, so we'll just move on to how I would conduct the exam. So the first thing I'd like Cece to do is just do a very basic movement. So I always like to see the athletes doing a movement to see how they perform. So I'll ask Cece to do a squat for me. Very good. And I'm looking just to see the stability of the movement there, and if there's any pain at any specific range, and whether or not there's a compensation on one side to the other, which there isn't here. So the next thing I'd like Cece to do is just walk up and down for me. I'm just going to observe how she walks. So we're looking for any evidence of an antalgic gait, looking to see if there's any asymmetry, if there's something like a Trendelenburg gait, and just looking to see if she's in any discomfort when she's walking, but that seems absolutely normal. Now, because we're examining the lower back, at this stage it's important I always get the patients to walk on their tiptoes, just because they may indicate a problem with the S1, S2 nerve roots. So Cece, can I ask you to walk on your toes? Very good. And all the way back. Brilliant. And that's absolutely fine. So the next thing I would do is I'm going to ask Cece to stand here, and I'm just going to inspect the back. So I always start from the front, looking at the level of the shoulders to see if there's any imbalance there, which there isn't. And if you can turn and face that way, Cece. So in Cece's back, I'm looking at the normal lumbar lordosis and thoracic kyphosis there, just to see if there's any straightening of the spine, or if these are diminished, which they aren't. You can face away from me, Cece. So we're just looking at the appearance of the spine, looking for any abnormalities, see if there's any obvious scoliosis, which there isn't. Be looking for muscle spasm or wasting, any scars from previous surgery, and very occasionally you can get some fat atrophy, which might indicate that there have been some injections given into the spine previously. Now, I would always like to look at the gluteal muscles as well to see if there's any atrophy or wasting there, which might be important, but we won't do that today. Now, while Cece is standing here like this, I'd like to test for any pelvic tilt. So I'm just going to anchor the pelvis and have my fingers on the iliac spines, and just feeling to see that those are level, which they are. Very good. Okay. Right, so we're going to move on to do some of the movements now. So I'll ask Cece if she can lie on the bed for me.
On my front?
On your front, sorry.
Okay.
Very good. So when I'm feeling the spine, I'm going to start up in the cervical spine and just palpating each of the vertebrae individually, just to see if it brings on any pain. You let me know if you get any pain there, Cece, when I'm doing that. Now we're paying more attention to the lumbar spine today, so I'm going to be making sure that we've palpated them properly. And then no discomfort, no pain there. And what I'll do is palpate the paraspinal muscles. We can see if there's any spasm here as well, any tenderness. And on the other side as well. And there's nothing there, very good. The next thing I'll do is palpate the SI joints again, to see if there's any tenderness over there. And whilst in this position, it's a good chance to palpate the piriformis. Usually rotate the leg just to isolate that. And then I palpate down onto the ischial tuberosity as well, just to see if there's any hamstring tenderness, which there isn't. Very good. So now we're going to do some movements. So I want Cece to sit on the edge of the bed for me.
Yep.
Very good. So sitting down stabilises the pelvis and allows for true reflection of the actual movement of the spine. So can you bend forward
Mhm.
as much as you can for me? Very good. And all the way back for me. Very good. And then down to one side. Good job. And then down to the other side. And then cross your arms for me and rotate round. Good. And rotate to the other side. Very good. So that's us done the movements there. So because we're examining the lower back, I always examine the hip as well. So if I can ask Cece to
Like that.
go onto your back for me.
Yep.
Very good. So we're going to do some simple movements of the hip. So I'm going to lift this high off the bed for me. You let me know if you're sore at any point. And then we dorsiflex the foot just to see if it brings on any sciatic irritation pain, which might be numbness or tingling down the leg. Do you have any pain there?
No.
No, good job. And then just testing the hip as we would with some internal and external rotation and abduction and adduction, and there's no pain there, which is brilliant. So now I'm going to do my specialised tests that we do especially to look for any SI joint problems. So the first one that I would do is a Faber's test. So I'm going to take the hip into flexion, abduction and external rotation and press down to see if we can elicit any pain in the SI joint, which there isn't. And then I'm going to do the slump test. So if I can get Cece to sit on the edge of the bed there.
Yeah.
And I'm just going to lift your leg up and I want you to lean forward as much as you can. Good. I'm just seeing if that brings on any pain in the back, which it doesn't. Now if I get Cece to stand up for me, so we're going to do some other tests for the SI joint. So we're going to do Gillet's test looking for SI joint rotation. So I'm going to stabilise the pelvis and I want Cece to lift her right leg as high as you can for me. Good, there's no rotation there. And then similarly, we're going to do the stork test. So I want Cece to lift her right leg up for me and lean back. Very good. Any pain or discomfort there? No. Very good. Okay, so I'll get you to go back up onto the bed for me. Because we're testing the lumbar spine, it's important to assess the nerve roots to see whether there's any pain being referred down from the lumbar spine. So what I want to do is test the dermatomes first of all. So the way I'm going to do this is just, I'm going to feel your leg, Cece, and I want you to tell me if it feels normal on both sides.
Okay.
Alright, so first of all we're going to test the front of the thigh. You tell me if that feels the same.
Yeah.
So that's assessing S2. And then we're going to come down here. Can you feel that? So that's assessing L3 across the knee there. Then we're going to test on the inside here. Yep, normal both sides.
Yeah.
And that's testing L4. And then you feel that both sides.
Yeah.
That's L5. And then S1, the lateral side of the foot. Does that feel okay?
Yeah.
Very good. And then we're going to do some strength tests as well. So what I'll get you to do, obviously we'll do this on both sides, but for this examination I'm just going to do it on the right. So can you push your leg against me as hard as you can? So we're doing knee extension there, and that's testing L3. Then we're going to do pull your your foot up towards you. Very good. That's testing dorsiflexion, which assesses L4. Then we're going to do great toe extension, so push against me there, and that's testing for L5. And then push your foot away from me. Very good. Testing S1. And then for S2, if you pull your leg toward me. Very good. And that's normal power and tone there. And the last thing I would want to do is check the reflexes. I haven't got my tendon hammer with me, but basically the two main ones that I want to be checking are the knee jerk reflex, which would assess L3, L4, just hitting on the tendon there, and then the ankle jerk reflex, which assesses S1, S2. But the examination today was completely normal. Had it not been, and we've done some further investigating, but as I said, everything was normal today, and that's how I would systematically go through doing spine examination. So thank you very much. Thank you.